Hi, I'm Erin Kramer. I'm a physical therapist at St. Luke's, and I'm going to talk to you a little bit today about how my career started and a little bit about physical therapy. So let me get my PowerPoint up here. Okay, let's get started. So, sorry. Like I said, I'm a physical therapist at St. Luke's Hospital in Cedar Rapids, Iowa. I'm both an acute care therapist as well as a rehabilitation therapist. So what does a physical therapist do? This is from the APTA website, American Physical Therapy Association. I figure I couldn't say it better than this. Physical therapists are movement experts who improve quality of life through prescribed exercise, hands-on care, and patient education. I put it in layman's terms underneath, physical therapists help patients achieve their movement goals. So really that can be anybody from birth to literally death. The goals can be a high-level athlete trying to improve their game, all the way to a baby trying to hold its head up, anything in between. Being an acute care therapist means I work in a hospital. I see a lot of older populations, the geriatric populations. A lot of people I'm dealing with are working on safely standing up from a chair, walking around their home, having enough balance to cook a meal for themselves and being safe at home. But there are lots of other physical therapy opportunities that we'll get into in a different slide here. But I wanted to point out this fact that Forbes has consistently ranked physical therapy in one of the top 10 for job satisfaction. That kind of deals with flexibility, security in your job, as well as pay. To be honest, Iowa's pay of physical therapy isn't the greatest looking at the medium national average, but it's okay. And I think if you have a passion for physical therapy, all the opportunities that come from physical therapy, including extremely good job security, makes it very worth it. Quick, brief little history. I just like to point out that this started an all women's profession. Most times you're not going to hear that in most professions, but it kind of started out of World War I. Mary McMillan started it helping out soldiers, and it kind of was along with that polio epidemic. And now, obviously, men are physical therapists too, and we have the American Physical Therapy Association. So the wonderful thing about physical therapy is you get to work in a variety of different settings. After you graduate physical therapy school, you can work in any of these settings. You don't have to have a specialty residency or anything like that that some doctors do. You're stuck in your career and you want to change positions, you can do that. You can completely go between one setting to the next. Sometimes that's a little scary because you don't have much experience or it's been a while since you've reviewed those things, but that is an option for you in your job. So I'm going to run through some of these here. Acute care, like I said, is in the hospital. And even within the hospital, you can see there's a lot of settings that you can work in. And I am lucky enough that I get to rotate throughout all these settings in the hospital. And I get to see a variety of different patients with a variety of different disease processes, ailments, and medical conditions. Another setting is rehabilitation. At St. Luke's, inside the hospital, we also have a rehabilitation unit. I get to work on that unit as well. Those people tend to stay a little longer than a typical hospital stay. They stay for weeks at a time, and we see people working on rehabbing their bodies and getting their endurance back after different kinds of illnesses and conditions, but kind of some common ones are like a stroke, traumatic brain injury, spinal cord injury, sometimes polytrauma, which means maybe you were in a motor vehicle accident, you have a broken arm, a broken leg, a broken pelvis, maybe you have some internal organ damage as well. People that have undergone amputations, Parkinson's disease, Guillain-Barré, that's just literally the tip of the iceberg. But Get a wide variety of patients there that have a little bit more complex diagnoses than just had their hip replaced. You can also work in a skilled nursing facility. Sometimes that's within a nursing home and sometimes that's in its own facility outright. But what those are people that need a little more time after the hospital to recoup, recover, and get home. A lot of the time it's the geriatric population, and they are working on not staying in this skilled facility or this nursing home forever, but getting therapy a couple times a day to get them back home safely. Also, home therapy. People can stay in their home after a hospital stay, or even maybe their child at home, and a physical therapist comes to them to help them with their mobility goals. Outpatient therapy. I think this is kind of what people typically think of when they think of physical therapy. Somebody tore their ACL or they're rehabbing after a knee replacement. They go to a physical therapist a couple times a week to hopefully rehab and get better. There's also option for sports that, professional teams have physical therapists. I do not have a lot of experience with that, considering I'm working with the elderly population mostly, but there's opportunities there all over the country. There's aquatic therapy that kind of isn't really outright on its own, but as an outpatient therapist, you might be taking people into a pool and working on their rehabilitation that way. At St. Luke's, we have an emergency department therapist. So what she does is she sees people and helps determine if they can go back home, if they're safe enough on their feet, if they need to be admitted into the hospital. We'll get into an example of what's called vestibular therapy later, but sometimes she's seeing people for dizziness. Lots of variety of things you see in the emergency department, including possibly coming in for pain. Women's health is another setting, pediatrics as well. Sometimes it's for a new condition of the pediatrics, or it's called what's called a congenital condition, or something somebody was born with, to work through things to help this person move, help their parents learn how to help them at home as well. I put travel at the bottom. You can travel as a physical therapist. There are options all over the country. You actually make pretty good money traveling, and you can be in a variety of settings as a traveling PT. I'm going to show you a video of what's called gait training. That's a fancy way of saying teaching somebody how to walk again. You're going to see a gentleman after he had a stroke, and he's on a rehabilitation unit. So he was staying there for weeks at a time, but I'm going to try to bring this up right now.
So even though there was a part of Stephen's right brain that was damaged from the stroke, highly intensive therapies, challenging, task-specific, 3 hours a day of therapy in the first month to 3 months after the stroke has the greatest opportunity for the brain to make new connections around the injured area of the brain.
When Steve first got here, we were unable to stand. He needed 2 people to transfer. We were unable to walk.
I don't think she gave up on me. I think I did a few times because I didn't think I was going to be able to do it.
So talking about that gentleman, it said he had a stroke. A couple of things I wanted to note in that video. One, you might have noticed there was a brace on his leg to help him walk. Who makes that brace are called prosthetists because it's a prosthetic. But as physical therapists, we get to kind of ask for those things, have the doctor prescribe them, but we make suggestions to the doctor to say, hey, this guy is having trouble picking up his foot after a stroke. He could use such and such a brace. So we get to help with the fitting of that, monitoring that. Another thing they said is he had 3 hours of intense therapy afterward. That's that rehabilitation setting. So sometimes you will see patients several times a day after an acute illness this guy after his stroke to help him regain mobility and independence. And then I love that comment at the end where the patient said, you know, sometimes I gave up on myself, but she never did, referring to his physical therapist. That's the greatest thing about working with patients is you get to be their coach, their cheerleader, and help them along in their path to recovery and make a giant impact. So that is kind of an example of what we do, but that's just a small subset of what we do. How do you grow as a physical therapist, and how do you kind of climb the ladder in this career field? Well, you can go from being, you know, just a clinical physical therapist to the manager or the supervisor of the physical therapist that you work with. There are specialty certificates as well. All different kinds of specialty certificates: stroke, brain injury, geriatric, a little subset of physical therapy. What I mentioned before in the emergency department is called vestibular therapy. It's kind of a niche physical therapy subset, and it's kind of my passion. I like to work with patients that are dizzy and help them feel better. I have an example here. Again, I'm going to try to pull up this YouTube clip, and it's going to show somebody's movements, a small screen with how they're moving their head, and you'll see their eye really big, and you'll notice something strange about their eye. This is showing how the patient feels dizzy and how physical therapy can help them feel better. So let's try to get this up here real quick.
Now when she does that, she'll get a position now and has very little nystagmus. I'm going to have her turn her head all the way to the right side. Now when she does that, she'll get a brisk horizontal nystagmus to the left. And we've timed this, and this does not fatigue.
Here. So that is kind of strange, and it's like, wait, they're not doing any movement here. They're not really, besides turning their head. It's kind of, like I said, an offshoot of physical therapy, but what they were doing is positioning her head to help align her inner ear, and you can see her eyes going. Her eyes end up telling us if she's dizzy, how she's dizzy, and how to fix it. So that's another thing you can get specialized in. It's called vestibular therapy, and I think it's really fun because you can kind of watch doctors' heads spin about it when you're trying to explain it and when you show them how you're fixing the patients as they do it. Another thing you can get into with physical therapy is teaching. Obviously, there are physical therapy schools and they need teachers. So you can get into research as well. You can become a clinical instructor. So that is pretty common to be able to do. If you don't want to be a full-on teacher, you still want to be seeing patients. As students get to the end of their schooling, they go on what's called clinicals, just like how doctors have to go in their residency programs. So students are with other physical therapists paired up, and you're teaching them those hands-on valuable experiences. The last option that I could think of is kind of opening your own practice. You could do that for outpatient physical therapy and have your own practice and have other therapists working for you. So what do I love and what are more challenging things in my job? Well, I could probably go on forever about the loves of my job. There's a reason I'm doing this presentation. It's because I like my job. But I love working with people. That includes the patients I see and the coworkers. Making an impact in their life, making somebody be able to move again and be independent again is just, there's just no better feeling. We have flexibility in our schedule. I get to work part-time and share my job with another physical therapist, but even if you're working in an outpatient setting, there usually is flexibility. You might work 4 10-hour days, or I used to work 3 12-hour shifts in the hospital. So there's a little wiggle room to play around with there. You never have to work an overnight shift. You know, nobody wants to do physical therapy at 3 a.m. So that's always good. I like that it's a physical job. You're up, you're moving, you're not having to sit at a desk all day. And you're also not having to stand all day. Like if you were a cashier or a hairdresser, you know, you get to be able to move and move others. and never ever boring. I say this every day that I've never been bored for 1 minute at my job, and I've been there for quite some time now. So I think it's great. Some challenges of my job: documentation. Nobody likes paperwork, but we have to document every patient, about everything we do with every patient we see, and it takes time and it's not as fun. Schedule. I had it on the top part of what I love about my job, but working in a hospital, the hospitals never close, so you do have to work some weekends and some holidays. Right now, it's only 2 holidays a year for me, and it's about 1 weekend every other month right now, but sometimes that ebbs and flows. Sometimes it's more, sometimes it's less. Another challenge I put is having to sell my services. Sometimes patients are in the hospital for the fact that they had a heart attack and they underwent CPR and they don't feel good at all. And I have to tell them, let's get up and get moving so you can get healthy and back home. And they don't want to hear that. So that's hard. And I don't like seeing people in pain as much as people think that physical therapists do. That's kind of my joke there on the slide. We really don't like seeing people in pain, but sometimes we know the ends justify the means, so we gotta push through that and help them get better. And then the last thing, insurance. I'm sure any healthcare provider will tell you that having to deal with insurances and understanding the ins and outs of that is never a fun part of our job, because we just want to treat patients and make them feel better and give them everything they need. So how does one become a physical therapist? Well, you're going to need your 4-year bachelor's degree. You can really major in anything, much like going into med school. You can be a major in anything: music, science, what have you. But you will need some specific classes completed in order to be admitted into physical therapy school. You're going to have to accumulate some observation work or volunteer hours of some sort in a physical therapy setting. You have to apply to PT school. That process is kind of a long application, and it takes, it's not just sit down and do it in an hour. And then you have to take your GRE, which is like a grad school entrance exam, much like the ACT to get into college. Then you go into graduate school. You'll become a doctorate of physical therapy, so that's the DPT. Graduate school is usually 2.5 to 3 years. Most of them are 3 years. The University of Iowa graduate school is only 2.5. You have mostly in-class work and then some clinicals scattered throughout, most of them being at the end of your class time. Clinicals is where you are paired up with a real live working physical therapist, and you're working alongside them, seeing patients, writing documentation, and basically learning how to become a physical therapist. At the end of that, you take a licensure exam. It's about a 4-hour test, give or take. And then if you pass, you're a licensed physical therapist. There are 5 physical therapy schools in Iowa. I listed those here. I did a shout out to my alma mater, Des Moines University. Obviously, class sizes are typically pretty small, about 30 to 50 students based on the program. So admission isn't easy to get into. It's based on your college GPA, your GRE score, observation experience. You usually have an interview. Most schools do an interview, and then admissions essay and references. So lots of things, but study hard and get good grades and you should be okay. What's needed to become a physical therapist? So like I said, in school, you need good grades. You want to be a well-rounded student. So you don't want to just have academics. You want to have volunteer experiences. You want to have experiences outside the classroom that you can speak to that help you become kind of a well-rounded person. Experience I put in there again, but it's kind of like life experience, Sometimes people take a gap year between college and grad school to work in some sort of healthcare setting, a lot of times as a physical therapy tech, to just get a well-rounded experience. Personality-wise, you're definitely going to have to be a people person. You're with people all the time. So if you aren't into working with people, physical therapy really isn't for you. It's good to be hardworking, a critical thinker. You have to be able to make decisions as you're treating patients, literally on the fly, and everything, the human body and people are never predictable. So you don't have a recipe for everything you're going to do. In my opinion, I think it helps to have some sort of psychology background. I was a psych minor. I think it's an awesome major or minor to get into in college, but you're going to have to be with these people in hard times. Usually if you're going to physical therapist, you're not feeling the best. So it helps to have that background. And then it does help to be physically healthy, especially in the acute care setting. You know, you're lifting patients that can't help themselves. So sometimes patients are morbidly obese, and sometimes even the little 98-year-old 100-pound little lady might need a lot of assist. So you have to be physically strong and able-bodied. If you're interested in becoming a physical therapist, contact one. I have my email. You guys are very welcome to email me. I'm not the best at responding quickly, but I will respond to you. Or, you can Google a physical therapy facility around your area and call them, email them. I'm sure they'd be willing to at least point you in the right direction. You can volunteer and observe. I started as a volunteer at St. Luke's. Then I was a physical therapy tech throughout my schooling, and then I was a physical therapist. So St. Luke's has a lot of opportunities. Any other outpatient facility, just call them or email. And I would also look into PT program requirements. So I would make sure that you're looking, if you're down the path a little bit in college, make sure you're getting those core classes in so you don't have a whole major done and then you have 2 or 3 more classes yet to complete for a whole nother year. So that was it. I hope this gives you guys good information about what's needed to be a PT and a little bit about the PT working field. And I hope you consider it as a future career.